This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
To separate out competencies around what we're good at as humans and what AI is good at. This is one of those conversations that can be a little touchy for folks. What we're good at, which is our creativity, our aspects of leadership. We have dexterity that AI doesn't have. We have a sense of perception that maybe AI doesn't have. Whereas we might start to think about algorithms in terms of their speed, their scale, the ability to dive into deep data sets far more efficiently than we can in real time, their ability to predict better than we can.
Welcome to Sg2 Perspectives. I'm your host for today's episode, Jayme Zage. I have an interesting topic for today, and this stemmed out of an internal debate I was having with one of my colleagues on whether there is still innovation in digital health beyond AI. To have that debate, I decided to invite Andrew Rebhan, my colleague from Sg2, to have this conversation with me about what's happening in the digital health space. Is it still innovative or is it baked in now? Andrew, welcome. And what are your initial thoughts?
Thanks, Jayme. Happy to be back. As Sg2's digital health researcher, I certainly hope that there's still something to say about digital health's impact and its broader effects on innovation. And there's a number of different factors we're taking into play here. AI is red hot right now as a subsector of digital. On the one hand, like we see all these headlines and attention and investment in AI. I'm also going to acknowledge that there's a lot of exhaustion and saturation in that space. Digital health has a surge and purge cycle. We tend to gravitate to something and run at it full force until we get sick of it. And then we pull back. And then all the skeptics come out and say, I told you so. I saw it with virtual care during the pandemic. I've seen it in other iterations. And I feel like AI is definitely in that potential bubble. It's fair to challenge the true innovative nature of what we're seeing with digital technologies. This is just an embedded function of covering innovation. You need to have the stamina to keep up with it over time. And I understand why that can turn some people off or make them feel just exhausted that we've been talking about this technology for so long and we still haven't really seen pilots that scale to full deployment, or we haven't really seen a true ROI. There's always those debates that go on. You just have to roll with it. Technology does over time become more of an embedded function of just how we do the business of healthcare. If it just becomes ingrained in the day-to-day in some level, sure, it just becomes a normal facet of your life. And you don't really think of every piece of technology as being something novel.
Let's take a step back and lay out some of the specifics here. We mentioned AI, telehealth, virtual health with those televisits, but there's also some of the more asynchronous, the continuous monitoring that is now direct to consumer in some cases. What are some of the other digital health components that you're keeping an eye on?
I've always built my research focus around select buckets. I mentioned the artificial intelligence space. We could just put that on the shelf for now, right? We've covered that a lot. And that's definitely one segment that we have to keep track of. The next one is certainly the virtual care space. So I've been looking at the trend of video visits that we saw out of the pandemic. That has really quieted down. And a lot of that is based off of the really frustrating stagnation that we've seen with policy around how do we pay for this and how do we continue to think about the Medicare waivers. And for now, they're just pushed back again until the end of September. That consistent inability to draw a firm line in the sand has actually hurt adoption around virtual care. And it's one of those things where the longer this goes on a temporary basis, the more harm it does for us. It kills our Sg2 forecast around virtual visit forecasting for the next decade. How do we not have firm ground yet after so many years after the pandemic to feel like this is something that makes sense, at least as far as building out a hybrid care model for the future? I just don't see how we wouldn't incorporate aspects of telehealth into that. The growth of chronic disease, the senior population, of home-based care, all these ways by which we start to think about remote monitoring technologies and how they can be embedded the right way to supplement care and think about all the gaps that clinicians have day to day. There's this phrase I like to say that there's any number of thousands of hours in the course of a year. And if you think about how much of that time you spend engaging with your doc, it's a mere fraction of that. And so just by nature of wanting to make sure that we're tracking care, that we're understanding what's happening to patients when they're not sitting in front of us, that's something where virtual care technologies just has to play a role. So that's the other big bucket. The third one is just all the fun stuff, the emerging tech that's on the horizon, that's anywhere 5-10 years out, that everyone dismisses with a wave of the hand. And they're like, that's not something that we're going to invest in today or tomorrow. But next thing you know, it's by your doorstep and you don't have a plan for it. I do try to monitor those technologies. When you're in healthcare, there's certainly some practical restraints that keep you focused on short-term goals and near-term investments. And so that's where I try to keep the balance.
You just answered in that debate that there still is innovation coming in digital health beyond AI. So thank you for affirming that.
I'm active on LinkedIn, and there's been a lot of telehealth bashing on LinkedIn. A lot of docs even that feel like they won the outcome of it because they saw the quarter by quarter decline in the last couple of years, and folks who just feel like it doesn't work, it's bad medicine, and so forth. If we did take a glass half full approach to this, and if we had the appropriate reimbursement channels and just overall engagement, we would have had a different picture. It feels like if you're always going to be in a position of thinking of what is every reason why this is a bad thing or isn't going to work, you're going to make that reality happen. Telehealth isn't dead. It's just taking a power nap. Where does it get applied the right way that's clinically appropriate, but also understanding we need to have the financial infrastructure to make this viable for providers, to make them feel confident that we can continue to build upon in the future.
Some of these innovations, like the continuous monitoring, some of the other new technology that may be coming, may actually be able to have more of an impact because of AI. How is AI fitting into the ongoing evolution of digital health?
To separate out competencies around what we're good at as humans and what AI is good at. This is one of those conversations that can be a little touchy for folks. I've literally presented a slide that has some concentric circles and it separates out what we're good at, which is perhaps our creativity, our aspects of leadership. We have dexterity that AI doesn't have. We have a sense of perception that maybe AI doesn't have. Whereas we might start to think about algorithms in terms of their speed, their scale, the ability to dive into deep data sets far more efficiently than we can in real time, their ability to predict better than we can. It's not meant to pose human versus AI. It's just thinking, what are the competencies of these algorithms that we can start to rely on that we don't have to worry about ourselves anymore? And so one of those areas is definitely around data management. One of the biggest hangups around using mobile apps or dealing with genomic data or social determinant data is just there's so much information and there's no clinician who's just going to be sitting in front of their computer with a constant track of download of inbound patient data. To what extent can AI start to pour over that information, draw the unintuitive correlations in the data, think about all the predictive functions that can come out of that and start to guide us and nudge us to make sure that we're not missing anything in the care regimen? That's the type of ability that realistically, with the exponential explosion of digital data, we're not in a position to be able to handle that ourselves. There's nothing wrong with thinking about how AI can start to alleviate some of those challenges. If data is the future of how we think about improving aspects of care delivery, there's just that natural position where AI is proven to be better than us at doing these functions. How do we incorporate it into the infrastructure and use it to make sure that we're doing our best work?
Well, we still have to check it because it's increasingly hallucinating too. So
the hallucination or confabulation equation, that is definitely a risk, just like a lot of other potential risks that come with the technology. At the same time, there are measures by which organizations are starting to think about how to mitigate those challenges. And so everything from having a structured database of confirmed inputs that they know are verified that the AI can then use to pull from, where we can start to alleviate some of the concerns around how a model is ultimately sourcing and pulling in information through its output. There's always going to be risks like that. Even in the case of algorithmic bias is always the next. If it's not a hallucination, it's a bias, right? Like that. Those are the two things that get brought up quite a bit. Human beings are very biased at our nature. We have our own ways of introducing biases in our day-to-day life and work. And so it's natural that AI mirrors that in the way that it performs its functions and puts out information. Just being cognizant of that and ensuring that we're not just taking everything that AI spits out at face value, but understanding that if it performs as good as us, that might still be a good thing.
you talked a little bit about where we've settled back into a lower level of utilization, but it is still here. It's still being used at probably a little bit greater than it was before the pandemic. But beyond the policy pieces, are there other barriers to wider adoption?
It depends on where it's being used. If you ask a patient who's in a fairly remote location and has to travel extensively for a visit that is short, maybe doesn't require a whole lot of physical exam or extra imaging or administering antibiotics, it's more or less just an inconvenience. And we're talking about fairly like low acuity needs, urgent care needs. We can certainly see where the use cases start to play out. A lot of surveys show that patients are very on board with the idea of handling their medications, using virtual channels. So it's just picking those spots. I'm a little surprised at how much we still continue to struggle with that idea. Telehealth doesn't have to be the answer to every problem that we have. It's just more about the appropriate channels where it can offset either arbitrary barriers that we set up or thinking about some of the challenges that patients face. If you're on the healthcare side where everyone comes to you, maybe you don't really think about these things. Everyone's just the business of healthcare. Patients come to us and we treat them and send them out the door. But if you take the perspective of the patient, you start to see the opportunities and pockets where virtual care makes more sense. The other pockets that we've seen this is just in the building and scaling of something like virtual nursing or virtual care hubs, especially for those health systems that are across multiple states or multiple regions where they're just dealing with constraints around the number of staff they have or the number of specialties that they cover. The ability for telehealth to really just extend the reach of that workforce is something that I have a hard time understanding the counter argument to that problem where we literally don't have enough people. Can we start to expand beyond the 1-to-1 ratio in person and start to leverage virtual care to expand on that ratio and allow us to meet the demand that's seemingly never ending?
It's probably something like what we're seeing in telehealth use, where in some clinical practices, it becomes a part of the toolkit that, yes, you see the patient in person for some visits, but sometimes it's virtual. And then if you can start to layer in how you do it in different ways, it just becomes a way to expand that capability. It really is an incremental advancement in terms of how we use it, thinking about it as one tool in the tool belt as opposed to the only thing that you do is another key component of that.
In some sense, this goes back to the original question of, is digital health still innovative? Virtual care and everything that's happened since the pandemic and all the discussion and debate. And it's just funny because you think about the modalities of virtual care and we're talking about video visits, email or messaging, texts, or even the basic audio phone call. Like these are not groundbreaking applications today. These are just things that we do in our everyday life. Like we're constantly texting, we're constantly at work on our Teams calls, like these functions that have been embedded in our daily lives. But when it comes to healthcare, there's this massive debate for 5 years now of should we do this? Should we not do this? Should we pay for it? That's the funny paradox of what we think of innovation in this space is like at one point in time, shifting to a fully virtual remote capability during the pandemic, it was like the height of innovation because we all moved in one direction really fast. But then very quickly, we were all just saying, this doesn't seem all that necessary. We're going to go back to doing things the way we used to do it. That funny process of thinking about all this energy and time is spent on just deciding if we should continue to support audio only care encounters. There's a lot of patients out there that if they didn't have that phone call, they would have literally nothing else. Is that not good enough for now as a baseline? And then we build off of that in the right way, the different applications of other modalities of care.
Yeah, that's where the innovation is, how to apply the different emerged types of digital health in different ways to meet different patient populations' needs. And you mentioned the rural patients, and that's where in some cases you might have broadband issues where the patient can't get access to that kind of care as effectively. And that becomes one of the challenges. In a lot of cases, it's about their ability to get to that office visit. I know my own experience with virtual care is that my doctor's always on time for virtual care. Versus like you go to a doctor's office and you might sit there an extra 20 minutes, 30 minutes, an hour waiting for your appointment. There's a difference between primary care and specialty care in there too, depending on how overbooked they are. But those kinds of patient-centric concepts have become more front and center just with the use of virtual care, those telehealth visits, because it's made the clinicians think more about meeting the patient where they are. even if it's not through a virtual visit, but being on time, being receptive, being present. One of the other digital health technologies I've heard you talk a little bit about happens in an in-person setting, which is the ambient listening, going back to AI. And how does that augment the experience for both the patient and the clinician when the clinician doesn't have to necessarily take all those notes while the patient is still in the room?
That application, surprising how much optimism there is in the room whenever we talk about ambient documentation. I've been fortunate in the last couple of months to sit into lots of different meetings with different C-suite cohorts. So COOs, CFOs, CSOs, CEOs. And across all of them, they're focused on that ambient documentation application. And you would think typically these conversations, there's a lot of skeptics, but this is one of those bright spots that we've seen where they're hoping that this is going to deliver on some of the immediate ROI that they're looking for with AI. And then you start to get into some of the even more cutting edge spaces of generative AI now with agentic systems that are far more autonomous and starting to actually offload like an end-to-end process and starting to build out even like a network of agents that can do any other number of services for an organization. That's on the horizon. And we think about the evolution of Gen AI systems that are increasingly becoming more robust and more complex in their functions. There's just so much opportunity out there, understandably, a lot of risk too. So it's nice just to kind of see in the case of ambient scribing or documentation that there's a lot of support. And I really hope it works because it's just one of those test cases. Like I've been in the trenches on trying to defend telehealth. I don't want to do that also for AI where it's like constant battle, where you're trying to convince everyone to stick with it and that this is worth it. So I have high hopes for that.
I know you're on the road a lot. You're talking to a lot of our health system leaders. What are you hearing from these leaders regarding the state of digital transformation?
There is definitely a trend that it's a consistent priority amongst organizations. So look at any survey that's released. It doesn't matter from who. They're all going to say that something like digital transformation or innovation is always a high priority, whether it's AI, virtual care, or any other subtopic. A lot of our health system clients still struggle with the consistent need for investing in technology and defending their investments and really drawing out value from it. It's a consistent theme that we have in our discussions with our members to think about the ability to have defined goals, but to persist in those goals beyond short-term windows of opportunity. So if you're not thinking about the next 3 years, that's probably going to be an issue when it comes to digital transformation efforts. There's no finish line for digital transformation. And that's a really hard pill for a lot of people to swallow because they want there to be a finish line and they want to feel like there's some kind of end to this. And yet transformation persists over time. It's just this indefinite experience and we have to adapt to it. And there's always going to be some other technology or some other iteration of some device or tool that comes out. We need to be strapped in for the long haul here and feel comfortable with that. And not a lot of people can do that. That's just been one of the common themes around digital transformation is just being comfortable with change and being okay with the idea that there's not necessarily some end to this. We need to be willing to be open to change and make the appropriate changes over time.
Just like any other clinical approach to diagnosis or treatment, there's always innovation going on in terms of how we treat patients. Thank you, Andrew, for being with me today. This has been a great discussion on where digital health is going. Certainly AI is a part of that innovation, but I think there's other innovation that's going on too. And so thank you for helping me settle that debate. Appreciate it so much. And thank you all to our SG2 listeners. Until next time on SG2 Perspectives.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.